thank you for coming to speak with us today. Can you tell us a little bit about Cancer 101?
Absolutely. So Cancer 101 was founded in 2002, and the mission is to empower and engage patients and caregivers to partner with their clinicians to make informed medical decisions. I've been with Cancer 101 for 2.5 years now. There's a personal connection. I actually lost both of my parents to cancer, and so when our founder passed away 2.5 years ago, I left my role at Pfizer to take on her position as CEO of the company.
How exactly do patients use Cancer 101?
So the tools and resources that are disseminated at the point of care are intended to educate patients, so it tells them a little bit about their disease state. It provides them with a list of questions to ask their clinician. It provides them with a symptom tracker, a medication tracker. It literally is a tangible toolkit that's provided at the point of care, but at the same time it's an organizational tool. So it comes in an accordion file to allow them to file away paperwork, things of that sort. And then it comes in a binder for a reason. It allows for the toolkit to be personalized at the point of care. What you'll often see is patient education materials, often one size fits all, and education needs to be personalized because patients aren't one size fits all. And so as personalized medicine is emerging as a really important topic in healthcare, education also needs to follow in its path. We're also working on an electronic version, and the electronic version will also have that personalization factor where based upon the profile of that patient, based upon the interactivity of that patient, it'll filter the information that they receive based upon their specific needs.
Are you targeting all different types of cancer or one in particular?
We're in 22 cancer types right now. We're also developing platforms for the young adult. We're developing platforms for different ethnicities as well, because oftentimes you'll see material translated into a particular language for a patient, let's say the Hispanic population, but it doesn't take into account the cultural taboos of that culture. And so, for instance, right now we're working on something called Project Hisparity, and Hisparity is essentially a combination of Hispanics and disparities. And so in this tool that we're developing for them, again, it's taking the Cancer 101 planner or navigator and really tailoring it based upon the cultural needs of that population.
What has the response been from patients who use Cancer 101?
We actually get 300,000 requests a year. It's a nonprofit organization, so we haven't been able to meet the demand. We get requests from over 40 countries. It's why the electronic version is so important. But at the same time, there are some patients that rely on that tangible tool. We have focus groups of patients who will bring in their 7-year-old tattered planner that they've made notations in, they've collected business cards, they've made notations from insurance companies and clinicians, and it becomes their go-to resource during the course of their journey. And as we start to build out the electronic, what we found is that we're going to have to keep the tangible tool in parallel because there are just some patients who like to write things down.
What have you thought of MedX so far?
Medicine X is by far my favorite conference. It's entertaining, it's informative, it's engaging. The staff here has just done a marvelous job, and every year I look forward to coming back to Stanford.